So phobias. This is fear of something or a situation, and that fear causes intense anxiety and can even lead to a panic attack. These people don't even have to actually see the object that they're scared of or be in that situation. Even thinking about it can provoke that type of anxiety. And these patients understand that the fear is excessive, but they can't help the way that they feel. They often don't seek medical help because their level of anxiety in general is not more than the average person. It's only in the presence of this thing that they fear that the anxiety happens. And if these patients do seek help, often they have an anxiety disorder on top of the phobia. Okay? So for example, agoraphobia. So agoraphobia, many of these patients actually suffer from panic disorder, and these patients fear being in places that might be hard to escape, or that might cause them a lot of embarrassment if they start to feel symptoms of that anxiety, okay? So certain patients might lose control of their bowels, or they might pass out, or they might vomit, and they don't really want to be in a situation where they can't escape that easily, and that would bring them a lot of embarrassment. So they might be scared of trains, buses, might even be scared to leave their house. So that can be very debilitating. It happens more in women than in men, and it often occurs around 20 to 30 years old, and it can last for several years. Okay, so next one is social phobia. This person might even be scared to answer a question. If you were to ask them a question, they might be embarrassed to because they feel like maybe they might say something that will cause scrutiny, and they will feel the palpitations and the sweaty hands. And it does interfere with their occupational and social functioning. Okay, specific phobias. This is what you normally see as phobias as far as like animals and environments. That's like people that are scared of spiders and rats, and I'm really scared of snails. And then environments, like scared of heights, scared of the sun or the clouds, whatever it is. So that would be like environment, right? And then blood. Many people are scared of blood, scared of needles, scared of injury, scared of going to the dentist. So that's very specific. Okay. And then there's situational phobias. People are scared of bridges, not because they have agoraphobia, or maybe they do, but really just they're really scared of bridges, scared of elevators, scared of trains, just scared of being in those situations. It brings them intense anxiety. So a couple of beliefs about the reasons why this occurs. There's Freud believes that when you were a kid, you had incestuous feelings towards the opposite sex parent, and due to the fear of getting in trouble by the same-sex parent, you repress those feelings, and you displace that fear of that same-sex parent onto an object, and that object is now what you're scared of. So that's your phobia. Okay, so modern psychoanalysts believe that it could be symbolic. So let's say a child's taken out into the water by her uncle and he molests her, and now she's deathly scared of boats. She has the phobia of boats. But the real underlying fear is of her uncle, the freaking molester, right? She's not actually scared of the boat. But, okay, so then now the learning theorists believe that it's a conditioned response. And if you watch the video of Pavlov and the conditioned unconditioned responses, you will understand that. So it's a conditioned response, or it's a reward. So they fear something, and now they don't have to let's say they have a phobia, and because they have that phobia, they don't have to experience the fear, and because they don't have to experience the fear, it's a reward, and so it basically just perpetuates the phobia. I don't know if that makes sense, but it's kind of like a reward system, okay? You're scared of something, you don't have to face it, and it's rewarding not to have to face it, and so it's perpetuating. Or modeling. Let's say your mom's scared of spiders, and now you saw how scared she was, and as a child, and now you become scared of spiders as well, okay? Cognitive theorists believe that it's basically just, irrational thinking, and it's, so people have negative self-statements or irrational beliefs. So just like faulty thinking. For example, my grandmother told me that if you were to go play in the rain, then you would catch lice. and she just would tell me that all the time. And when I was a kid, I was really, really scared of rain. Like, I would be upset if even a little bit of rain hit my hair, and it almost seemed like I had a phobia of rain. But it was through irrational beliefs. Thank you to my grandmother. Okay, but I'm not scared of rain anymore, and that's not a phobia that I have. So, or locus of control. So locus of control basically says some people have the internal locus and some people have the external locus. People who have external believe that certain problems that they have are outside of their control. So let's say they have a stressful event and they believe that it's caused by something external, and because they believe that, they and that external thing might be the phobia. So when people have that internal locus of belief, they are, I mean, it seems more like they have a more clear understanding of what's actually the cause of the stressful event. So with internal locus control, people, they have a stressful life event, and then they experience the anxiety, and now they contribute the anxiety, or attribute the anxiety to the actual stressor, right? And that way they can solve the problem. But people with an external locus of control, they experience something bad, they feel the anxiety, and they attribute the anxiety to an external source, not what is actually causing that. And that leads to a phobia. Okay, so external, internal. And then biological beliefs, or biological theorists believe that there's temperament. So some children already have basically an innate fear of certain things, and then something happens that just triggers that fear, and that turns into a phobia. Or a learned experience. Somebody that's been locked in a closet when they were children as punishment now grow up and they're scared of small spaces such as elevators, right? That would be like a learned experience. So for these patients, they can take benzodiazepines, they can take SSRIs, MAOIs, and antihypertensive. So the drug's basically the same. What you're worried about is basically the same, right? The benzos, you're worried about addiction, and you need to titrate the patient when they come off of it. And people can become dependent on these drugs. Okay, the SSRIs, limited side effects. They're usually the first line of drugs because they work and they don't have a lot of very scary side effects. Okay, the MAOIs not as popular because, well, you know that you have to be very careful what you eat. They have very scary side effects, and so, but it can be given for phobias. And then the antihypertensives, like the propranolol again and the clonidine, because it helps calm the patient down. So behavior therapy. Okay, so I mean, the patient can go see a psychiatrist, like the same as the other conditions. They can see a regular psychiatrist that can help them through this phobia. But like I said, they normally don't seek help because they don't have more anxiety than other, just the general public. Only when they come in contact with this thing that they're scared of. So, okay, first we're going to go over behavior therapy. So systematic desensitization and implosion therapy. Those two are very popular. And systematic desensitization usually has two factors to it. And the factors basically involve, first the doctor is going to teach the patient some techniques to relax, right? Because somebody who has intense fear is going to need to learn some relaxation techniques. And the second thing is progressively exposing the person to this fearful stimuli from, the least scary to the most scary. So just slowly. So before it occurs, so let's say somebody's scared of elevators, you're going to teach them some techniques of relaxation, and then you're going to have them imagine themselves walking into the lobby, and then eventually get into the elevator, and then up the elevator, and then out of the elevator safely, okay? And all along the way teaching relaxation techniques. So, and then eventually maybe the psychiatrist will actually come with the patient and maybe actually do, the patient will actually walk into the elevator and go into the elevator and go, up the elevator. So this is systematic desensitization. Implosion therapy would be like just flooding. If somebody's super scared of spiders, you put them in a room and you fill the room up with spiders. And patients might refuse that because obviously it's really freaking scary, and it's actually hazardous to patients that might have a heart condition or they're really not that stable. So it's not the best thing to do if the patients aren't stable. There's such thing as prolonged exposure therapy, and this is more for post-traumatic patients, but same thing, you know, like breathing, relaxation techniques, and then giving exposure to the real stimulus that's scary, and then imagine exposure repeatedly with the therapist. So there's different therapies that are available, and then there's the eye movement desensitization reprocessing, and this is very helpful for patients with post-traumatic stress disorder, but it can also be used for patients with a variety of anxiety disorders. You're going to have to read that on your own because it's like 2 pages. So, but you know, that is 8 phases and basically helps patients through this. So there is help out there. Okay, that's it. Hope this helps.